Welcome to NTH and Hartlepool Voices, telling the stories of our people and community in our trust.
This is NTH Voices and my name is Colin Overton. We broadcast to the patients, staff and visitors to the NHS hospital trusts across the Tees Valley. Today in the studio we have some of the digital team and I would like them to introduce themselves and their position within the trust.
Hi Colin, great to be here today. My name is Ken Anderson and I'm the Chief Information and Technology Officer at North Tees and Hartlepool Trust.
Thanks Colin. My name is Jay Vasani. I'm a consultant gastroenterologist and also the clinical lead for digital program, and I work alongside my colleague Andy Adair at South Tees as part of the group.
Thanks Colin. I am Maxine. I am Programme Manager for the group model, working across both North Tees and Hartlepool and South Tees hospitals.
We'll start off with you, Ken. What is the longer term vision for your group digital work?
So Colin, a digital data and technology strategy which is really ambitious and wholly aligned to the group's strategic objectives. It will deliver digitally enabled services which provide exceptional care, quality and safety for all of our patients, a single view of information for our clinicians with group collaboration at its core.
Thank you. Jay, for you, the digital strategy is a key priority for clinicians. What work streams are you currently delivering?
Absolutely Colin. As you said, it is a key priority for all clinical staff. So as part of our group strategy, we're quite clear that we want clinicians involved in all steps of the journey, if you like. So as part of that, we've had several clinical engagement sessions. 2 already have been done and there are 2 others planned. We've also started work on undertaking a gap analysis which involves seeing what systems South Tees have, what clinical systems we have here at North Tees and Hartlepool, and see how we can bridge the gap. We've also started pilot work with our pathology teams who work across North and South Tees, and our digital strategy is already currently in draft form. We've also started work in looking at having a joint help desk to respond to queries from clinicians who are struggling with digital systems. And we're also quite clear that we can't do this work without having some extra resource. So we're also looking at how we can bring all that into the group.
So what will you be doing, Ken, over the next 18 months?
So our goal is to support the group clinical strategy. In this respect, the digital programme will be a key enabler. We're currently recruiting into 6 clinical boards and the expectation is that they will be up and running from this April, early May. As the clinical board developed, we're going to seek to understand their technical and their data requirements. In the meantime, there's a lot of work we can just be getting on with. In particular, we've already started working on how we can enable seamless working between the 2 trusts. Over the next few months, we'll be ensuring that our clinicians can connect to their clinical systems irrespective of which site that they're on. We're already investigating how we can deliver a single IT service desk, effectively a one-stop shop for all of our digital services. On the back of an event that we held with our community colleagues, we're looking to set up a user group to deal with some of the issues that they experience on a daily basis. Within the next 18 months, we're looking to identify ways in which our systems can share information to provide up-to-date patient-level data at the point of care. We're also going to do more in the way of what is referred to as single sign-on. So this is a secure way in which our clinicians can access a range of systems without having to remember multiple passwords. Overall, the digital strategy aims to improve both our staff and patients with a seamless experience to deliver proactive systems of care.
Okay, so you're telling me that the work will be clinically led. Jay, what reassurances can you give to the group?
Absolutely, Colin. So we want to reassure all our clinical staff that the work we are doing will be clinically led. The 2 engagement sessions we've had so far have been incredibly helpful. We've heard loud and clear that staff want to see several improvements, including having access quickly across the 2 trusts, having things like, as Ken mentioned, single sign-ons so people can log on to clinical systems to look after patients quickly. The community engagement session has also been helpful, and we're looking to set up what we call a clinical reference group to take this work forward. We have 2 other engagement sessions planned in March for the rest of our staff, including nurses, allied health professionals, midwives, corporate staff and others. As we mentioned before, our pathology service is already learning learning from collaborating digitally, and we're going to continue to tell clinical staff that if they have any other ideas, thoughts or questions, then please feel free to contact any of us in the digital group.
Maxine, how will you involve the patient voice in the transformation?
Thanks, Colin. So I started in post 9 weeks ago, and one of the things that I really want to bring to the group model is patient voice. It's something that I feel very passionate about. It's integral in terms of laying that foundation across not only our digital work but our vision for the group model as well as our clinical strategy as well. So I'm delighted to say that we have recently commissioned HealthWatch to do our external consultation work, and I think what HealthWatch as a statutory organisation will bring to the group work is very much that breadth and depth of our local communities that we serve. We have such a huge diverse demographic population, and it's important that we reach all those voices to make sure that we're clinically, digitally informed in terms of how we work going forward as a group. Internally, our patient involvement teams will absolutely mirror the HealthWatch consultation. So we'll have both that internal and external viewpoint, and that work will take place over March to July. At the end of July, we'll receive a list of recommendations that we as a group are accountable to, and what that'll create is a local dialogue with our local communities as well to make sure that we have that open conversation about what can and can't be achieved. Our local population is our biggest stakeholder, so it's important that we get this right from the earliest point.
Jay, just a quick one to you. Can you give us some examples of where services are already working across the group and how digital is actually supporting clinicians to deliver?
Colin. Yeah, sure. Thanks, Colin. Yeah, sure. So we have some strong examples already. Pathology to start with. The pathology teams have already started to work cross-site with a solid structure, and our digital and IT teams are supporting them to deliver this work. It's still early days, so we know we have some teething problems which we have to get through, but equally we've learned a lot from this work, which we hope will help us in spreading this across when we roll out other digital programs. Our ICT workforce currently work across site and will continue to collaborate and visit each other's teams to see what challenges people face, especially clinical staff face in real time. We'll constantly try and improve this work.
Ken, will there be any opportunity for clinicians and staff to actually test each other's digital systems and see what works?
There'll definitely be that opportunity, and I think that's one of the things that came out really clearly with the clinical engagement, is that clinicians at all levels across a wide range of specialties, they were really keen to understand from each other. And one of the great opportunities of the two trusts working more closely together is that we can identify which systems work best, and we want to familiarise respective colleagues on each other's systems and learn from each other. So even just yesterday, the community session that we ran, the teams were talking about various apps that they were using. So there's just really one very small example and something we can put into practice quite quickly. Jay was saying it's got to be clinically led, and this is really important.
Thank you for that. Maxine, final one to you. How will you keep the staff up to date and communicate with the workforce on the digital plans and changes that are foreseen?
Yeah, so that's a great question, and it's really important that we keep our clinical and corporate teams informed of the work that we're doing throughout this journey, because it is a journey that we're going on over the next year to 2 years to make sure that we really respond to what clinicians are saying. So we would welcome feedback on how often those communication messages go out, because we are aware that our workforce receives lots of messages, are juggling lots of things daily, so it's getting that balance right across both. I have to say both our communications teams across both sites have been absolutely fantastic in supporting the group model work, and we'll continue to work with both teams to send out messages at the same time so everybody receives the messages at the same time in the right way. The clinical triumvirate, once they're in place, which is expected to be around May time for the clinical work streams, once they're in place, they're kind of our key business change managers in terms of disseminating information through their clinical work streams. So we'll absolutely be utilising that workforce. We know South Tees have got a great staff Facebook page, and just talking to Jodie this morning, North Tees and Hartlepool are going to be replicating that as well. So we'll have a staff Facebook page, which is such an easy way of promoting positive messages and getting engagement as well. So there's lots of different ways in which that we're going to make sure that we put those comms messages out. It's just getting the right balance and not overloading staff, but absolute commitment to keeping people up to date.
Thank you for that. Hopefully we can have another session in the future and we can just upgrade everything that we've been talking about today. So can I thank you very much for coming in.
You're very welcome.
Thank you, Colin.
Thank you for joining us. Till next time, you've been listening to NTH Voices.